Hi there, my name is Emo Castle and I'm the nursing director here at camp. I've been here for 14 years and I love what I do, so if you guys ever have any questions, just find me at camp and I'd love to answer any questions you have. First, welcome to camp. I'm so glad you're here. Thank you for giving your time, your energy, and your love to our kids. You're gonna have a great week, so don't blink. It's gonna be over before you know it, so just enjoy it. It's just a wonderful place to be. What I'm going to do now is give you just a little bit of an insight into our medical program and what it is you need to be thinking about and remembering to keep our campers safe. Our medical team is everywhere, so you're never going to find yourself having to make any kind of medical decisions at all. You can tell a medical person by the orange lanyard. So each week we have 10 volunteer nurses, so each cabin will have a nurse. We have 2 nurses on during the day, 2 on the evening shift, and 1 overnight staffing the body shop, so you'll always find them there. We have 3 residential nurses plus myself, so 4 of us live here all summer long. And each week we have 2 physicians join us that are here and available to us 24/7. So we are really everywhere on camp, and if you need something, just reach out and let us know. Really important is I want to let you know just how ordinary our kids are. So the campers that you're going to see are just kids that need to have a week of playing and a week of summer camp. And that's what you're going to give to them. You're going to just be out there playing with them. You're going to have to remember some things to make sure that we're keeping them safe. But really, they're just kids and they just want to play. One of the things that we really like to do here at camp is to lead by example. If you're doing it, the campers are going to want to do it as well. So first of all, wear sunscreen. If you're putting sunscreen on, the rest of the cabin is going to put it on as well. Make sure you're washing your hands often and your campers are washing their hands. Just make sure we have sinks throughout camp. We have Purell dispensers throughout camp. So just make sure you're washing your hands. You're not passing on any germs. Make sure you're getting plenty of rest and that your campers are getting lots of rest. Camp can be a very active day, so make sure the kiddos are getting to bed and you're getting lots of rest as well. We have something called universal precautions here at camp, and what that means is if it's wet, sticky, gooey, and not yours, don't touch it without gloves. So just have a pair of gloves in your pocket so that if you have to do any kind of a cleanup, you can just put the gloves on and you'll be good to go. We also wear gloves when handling food and serving the food to the kids, so make sure you have some gloves available and you'll find them all throughout camp. Hydration is really important, so make sure you're drinking a lot. There's water bottles throughout camp, so make sure that you're drinking a lot and staying well hydrated. Make sure you're wearing your shoes. It's a really easy thing to do, but without shoes you could get some injuries, and that's just not a good thing for you or for our campers. So make sure you're wearing shoes as well as our campers at all times. If you're sick, please get checked out. If you're not feeling good, come on down to the body shop, get checked out. We would hate for you to pass on something to the campers. So if you're not feeling well, just make sure you get checked out. Make sure you're always allergy aware. So you'll get a list and you'll know what campers in your cabin have allergies, and just make sure you're keeping an eye on that and that the campers with allergies aren't around what they're allergic to. We also are a latex-free camp. We try and say we're latex-free, but there's things coming in from all over the place, donations and whatnot. So if you're bringing anything into camp, please make sure it's latex-free. If you can't tell, bring it down to the body shop and we'll do some investigation and maybe even call the company to see if it's latex-free. Because I would hate for something that you bring in to actually have latex in it and then for a camper to have a reaction to it. So make sure that if you're bringing anything in, you get it checked out to make sure that we can be latex-free. Next up, we're going to do some disease review. We're going to review each of the diseases and the certain things that you need to remember to make sure we're keeping these kiddos safe for their week. So enjoy your week, and here's some disease review. Here at camp, we like to say we remember so they can forget. We remember all the special medical needs that these kiddos need so that they can really forget for the week and just have a good time. Just have 6 days of fun and playing. We're going to look at each of the major diseases that we serve here at camp and the different things that you need to remember. Our first group are our campers with sickle cell disease. This is an inherited red blood cell disorder where the red blood cells are actually sickled shape. This sickling can cause them to stick together and clump together, causing decreased flow. And decreased flow causes decreased oxygen delivery to the cells. And this can cause a variety of different problems. What we see here at camp a lot of times is pain from this decreased blood flow. What we can do is keep them well hydrated and keep them very warm, and both of these things will what we call dilate the vessels or make the vessels bigger, which makes it harder for the clogging of the vessels to happen. We also want to make sure that we watch out for fever because they're at high risk for some pretty serious infections. So if they get a fever, we need to treat them with IV antibiotics. So campers with sickle cell, we want to watch for pain, watch for fever, keep them really warm, and drink lots and lots of water. Our campers with neuromuscular include our campers with cerebral palsy, spina bifida, muscular dystrophy, and other disorders that affect the neural or muscular systems. What's important with these kiddos is balance. A lot of them will have mobility devices or have some mobility challenges, and the terrain here at camp can be quite challenging, so make sure you're really keeping an eye on them. Check for hot spots for our kiddos that are in wheelchairs to make sure they're not getting any red areas or any areas of skin breakdown. Some of these campers will have seizures, and you'll know this on your CAG, on your Cabinet of Glance. You'll learn about this. For campers with seizure disorders, they need to be one-on-one in water, and what that means is that there is an adult within arm's length of them at all times. Do they need to cath? A lot of these children can't pee on their own, so we do it for them with different catheterizations. The Body Shop will take care of this, or a lot of the campers will do it themselves, but what we need to do is remind them and make sure that's happening every 3 to 4 hours. And if they need to be transferred, that we're doing it safely and we're watching out to make sure that nobody's getting hurt during the transfer. So neuromuscular, balance, seizure precaution, do they need to cath, and be careful with the transfers. Our campers with bleeding disorders include von Willebrand's and hemophilia. What happens here is they are missing one of their clotting factors and they can't sort of complete that clot or stop the bleeding. For these kiddos, we always have to be aware. We have to be aware for everybody, but particularly these kids. What I like to say is that we're going to prevent the injury. We're seeing some behavior that's happening that might cause an injury. We're going to stop it before that injury happens. If there is an injury, we need to get it evaluated immediately, particularly if it's anything to the head. So any kind of a bonk or head injury is going to be evaluated by the Body Shop immediately. And no contact sports for these kiddos. So bleeding disorders, always aware of what's going on, prevent the injury. If there is any kind of a head bonk, get it evaluated by the Body Shop immediately. Our campers with cancer, we have many different children here with cancer. ALL or leukemia is the most common childhood cancer and the most common cancer that we see here at camp. We'll have children who have just been diagnosed, children who are on therapy, and children who are in remission. What's important with these kiddos is watching for illness or fever to make sure that they aren't developing any kind of an illness. A lot of the treatments that we give them knock down their white blood cells and make it so they can't really fight back infection. Good hand washing is so important because of this. So campers need to be washing their hands and we need to be washing our hands. Watch the line means several of these kids will have lines or ports which we use to deliver chemotherapy. They'll be somewhere in the chest area. We need to make sure that we're not striking them at all or that the harnesses aren't going on them, and just being careful and being aware of them. And lots of sunscreen. The treatments that we use, again, make them very sun sensitive, so we need to make sure we're putting sunscreen on and we're reapplying often. So watch for illness, good hand washing, watch the line, and reapply sunscreen often. Our campers with collagen vascular include rheumatoid arthritis, lupus, and these kiddos have joint instability, especially here at camp. Once again, we have really difficult terrain, and the level of activity that they do at camp is very different than what they do at home. Watching for pain, because they can have pain, particularly day 3 or 4, they might really start having some pain because of using those joints so much. Watching for fever, because the treatments that we use do knock down their immune system. It is an autoimmune disorder, so we give treatments that knock down their immune system so they're not able to fight infection as well. And they may need a little bit of extra rest. So watch their joints, watch for pain, watch for fever, and make sure everybody's getting lots of rest. Our campers with mitochondrial or metabolic disease. Mitochondrial are the powerhouse of the cell, and they're in every single cell of the body. So these children can look very different from child to child based on where their problem is, and it can really affect all systems. So they may need some extra rest. Some of them have very specific diet restrictions or very specific hydration needs. So what's really important is communication with the cabin nurse. Each one of these children is going to be so very unique, and we really need to make sure that we stay on top of their needs so that they don't go into crisis while they're here at camp. So really that communication is super important. So they may need extra rest, know their diet and hydration needs, and make sure you're communicating with your nurse. IBD, or inflammatory bowel disease, we want to know their diet restrictions as well. Several of them will have some pretty strict dietary restrictions. And know where the bathrooms are. They might need to get to the bathroom quickly, or they might need a little extra time. So just make sure we're being aware of that, and watch their energy levels. The treatments that we use for these kiddos will also knock down their immune systems and knock down their energy. So we want to make sure that we're staying on top of that. Immunology, our campers with HIV, these kiddos we need to watch for fever. Our treatments, once again, are going to knock down, and their immune system isn't going to be working really well, so we want to watch for fever. The medications that they take may make them queasy, so they might need extra snacks throughout the day, and they may need lots of extra rest. Do know that our campers with HIV, our treatments are so good now. When we test them for HIV, many of them have what we call non-detectable viral loads. So we can't even see the virus in their blood anymore because our treatments are so good. But to do this, they need to maintain their meds. So whether they're twice-a-day meds or once-a-day meds, they need to make sure that they're taking them, and we need to make sure that that happens while they're here at camp. So watch for fever, may need snacks, and make sure they're getting lots of rest. Other are secondary. So campers will also have other diseases that don't sort of fit into our primary categories. With these kids, make sure that you ask questions, learn their specific needs. Each one is going to be very individualized, and that communication is going to be with your cabin nurse who's going to know your kiddo's medical needs, and you're going to be working with them. You'll meet your cabin nurse on opening day, so you'll meet him or her on opening day, and then they'll attend your medical meeting on the first night, and you can ask questions of them then about each individual camper. This is the most important. Everyone needs to lead by example. Everyone wears sunscreen, everyone washes their hand, we get lots of rest. We watch for different allergies, so make sure that if you have allergies in your cabin, you're looking out for them. And if you feel icky, please get checked out. You don't want to be passing something on to somebody at camp. So make sure that you're getting checked out. Come on down to the body shop if you're not feeling well. Very important. So we really want to keep it simple. So really, all you need is camp. So this is where you really need to listen up, because if you do these things, we're going to keep all of our campers nice and safe. So C stands for chug and clean. So that means chug lots of water, keep everybody hydrated, clean, wash your hands often, wash your campers' hands often, and we'll make sure that we're not passing on any infections. A stands for always aware. So you're aware of your surroundings, you're aware of what your campers are doing, and you're watching your campers. That way we're sort of staying one step ahead of that injury. And apply, and that's applying sunscreen. We're going to apply sunscreen, and we're going to reapply often. M stands for warm. We're going to keep all of our campers nice and warm. This gets difficult in the evening time, and transitions out of the pool into the Fox cabin are very cold. So just thinking about where you're going to be, make sure you're packing sweatshirts, you're bringing blankets, and you're really keeping your campers nice and warm. And P stands for please make bedtimes. It's super important these kiddos get into bed. Camp days are much longer than their normal days, so we need to make sure we're making it to bed on time and we're getting that rest they need. And please remember to play. Play is the work of childhood, and we need to make sure these kiddos are having the time of their life during this camp. Thank you so much for being here. Have a great week. Don't blink. It's going to be over before you know it. And if you need anything, come find us. We're always around. There's always a nurses in the body shop, so come find us if you need anything. Have a great week. Thank you.